So good evening to all. It's a great occasion to have my own dear Swathi giving the talk, and particularly on boys. And one person who should have been here, I don't know whether he is there or not, our Newton should have been here. I consider him as an authority on adolescent boys. Newton is there? Yes or no? No. Newton from Thrissur usually talks a lot about it. Swathi, can I say personal thing about Bombay?
Sure.
Can I say?
Sure.
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 Okay. Yeah. Okay. Then I must say something. I only will say one thing. To understand boys is very, very difficult. To understand girls, you give me 5 minutes, any girl in this world, I can make her speak. But the boys never. It is simply not possible, including me. The men never open up. And all the wives who think that I'm so close, I get everything, just remember they have a black box. Remember they have a black box. Only when an accident comes, you open the black box. I got it? Similar, same thing for boys. Actually, myself, Dr. Kamath, we were sitting in Swadhiji's house, how many years? Maybe 30 years ago. And she had an idea to take up street children as the theme, the main theme of her thing. So I was trying to convince her that why not take adolescents. So discussion went on and on. Both of us we were getting into late evening, very, very late evening. Then I told Swathi it's not nice because her husband was not there. 2 young boys are there. I said, adolescent boys, they won't like it. Don't let me go. Let us go. He said, no, MKC, they know you from childhood. What is there? All that. And, it went little late. And next day morning, first call I get is that her elder son scolded her for having 2 men at home when daddy was not there. This is the mind of adolescent. They are too much virtuous at that time on one side. On the other side, they can do any nonsense because of lack of control. So this is the only introduction I want to say about boys. Most people think they are obsessed with sex. They are, it is true. But now the problem that now that I'm doing maximum premarital counseling and all that, now I've realized that the boys are literally scared of girls. This is something we must know. They are actually scared. They can look at a girl, they can play fool, they can't do anything. They are literally, legally, socially, all that, they are little, that scare is there in their mind. So they tend to withdraw themselves. And one of the biggest problem I'm facing now is that after marriage, nothing happens. And thankfully, I'll tell you, a lady, 6 years after marriage, it could be, started off by just doing nothing. The treatment is only systematic desensitization. And that is probably the most successful because she was in Australia. She went back to Australia. 3 countries they tried, nothing worked out. Somehow it worked out. So what I'm saying is 3 areas we need to do. They are too much bothered about, right and wrong. That is one thing. But they don't have the willpower to stand with the right all the time. So they will go and do the wrong thing and then feel guilty about it. Number 2, they don't open up at all. And the girls at least will cry and open up, whereas the boys don't cry and open up. That means they are in trouble, and even the mother won't understand what they are going through. And number 3 is in spite of so much of overexposure to sexuality issues, when it comes to relationship counseling, the relationship issues, they are very poor. They do not understand girls just as much as girls do not understand boys. So with this note, Swathi, kick off. I'm waiting to hear from you.
Thank you so much. So thank you, MKC. It's always a pleasure to have him as a chairman. And as he said, we go long way back. And we have these pleasant memories of working together, of setting up adolescent health in IAP. Thank you so much, MKC. And I thank all the office bearers of IAP AHA Kerala, IAP AHA Trivandrum, and the names which you can see, Johnny Sebastian, Sibi Kurian, Deepa Janardhan, Rukmini. Forgive me if I have left out any important names, But thank you so much. And I can see so many senior people like Jason and Sangeeta Yadav, Asha Benakappa attending. So it's a real privilege. So I'll start sharing my screen. Normally,
Before
I
that,
prepare my
Swathi, one
lecture.
thing, Swathi, just one thing. I
Yeah.
will request our President Vijay Kumar and Jason Unni to chair, because if
Okay.
I do both, I will be doing bad job of both. So I have
Sure.
to leave.
Sure.
Thank you so much. Thank you.
Thank you, MKC, for being there.
Yeah. I'll have to join the other one that will go till 9 o'clock.
Sure. Sure.
Okay. Thank you so much.
So welcome the new chair, Dr. Vijay and Dr. Jason Huni. And with your permission, I will start sharing my screen. Do you both want to say some chairman comments? Are they there? Now, normally I am very particular about timing my lecture, and my lecture is normally ready 1 week in advance. But after a long time, I'm giving a lecture, and for the first time, I prepared this lecture yesterday. So I'm not very sure whether I will exceed the time. So I hope you will bear with me for that. Can you see my screen?
Yes, ma'am.
Okay. Okay. So I must congratulate IIP Kerala, AHA and all for choosing this topic, because most of us are so concentrated on adolescent girls, which is very important, and most CBSE schools call us for menstruation and other topics for adolescent girls, that boys often get forgotten. And I remember my own sons always saying, Ki, why so much privilege giving to girls, especially when their fees with affluent girls didn't have to pay their school fees. They used to always feel, why are boys marginalized? So I congratulate on this very important topic. And because I had two sons, this is a topic very close to my heart, because I know boys better than I know girls. So what I'm going to cover in today's lecture, I'm sharing my personal experiences of adolescent boys. Way back from 1984 to date, that is 38 years. I don't know how many adolescent boys I must have seen. And due to my husband IIS transfers, I have relocated to various cities and had different hospital attachments. So I've seen adolescents in Mumbai, Nashik, Nagpur, Delhi, Pune, 1 year in USA. And you know, every city has its own socio-economic culture, its menu. And I've also seen adolescents from slums and middle socioeconomic groups, because I worked in 3 medical colleges, Mumbai, Nagpur and Pune. And I worked in elite corporate hospitals in Mumbai, Delhi and Pune. So I've really seen adolescents across a wide spectrum of socio-economic and cultural issues. And last 15 years, through my NGO AACCI, I've been doing school and college programs. So I'm interacting with a large number of adolescents. And last 2 years in the COVID shutdown, being a senior citizen, I did not do face-to-face consultation. So I did teleconsultation more than 150. So I dealt with a lot of adolescents on teleconsultation. And then was in IPA, I established adolescent area in the International Pediatric Association. They didn't have adolescent health. And then every IPA Congress was to have a youth session. And then I have met cross-section of youth from various countries. And I've got a cross-section of what youth are from USA, America, Japan, China, etc. And last but not the least, based on my own personal experience of dealing with 2 adolescent boys who are now 43 and 38. So, though everybody knows that Dr. MKC Nair motivated me to start adolescent health in IAP, my journey in adolescent health began much before IAP. In 1984, when I was associate professor at Grand Medical College, my colleague Asha Ferwani and I were both pulmonologists. We did a lot of work on asthma and we had a lot of papers. And our head of department, Dr. A.G. Desai, had an adolescent girl. And Asha Ferwani had 2 adolescent boys who were national level swimmers. And she asked our head of department, sir, I'm very keen to do cardiovascular fitness assessment in these athletes. And he gave us permission. And in Glaxo laboratory at Worli, which had an air-conditioned cardiovascular fitness laboratory, we took 40 children from the age of 10 to 18 and did cardiovascular fitness on them. Stress test, lung function, ECG, etc. And we presented these papers in Pedicon 84. And over the next 5 years, all our papers got published. During this time, we interacted very closely with the parents. Now, at that time, my younger son was 6 months and the older one 5.5 years. So adolescence was a wonderland for me. And when I saw how the adolescents were parenting their children, it was fascinating. And we did a lot of questionnaires on these parents. And in 1986 Pedicon, we presented a paper on parenting in adolescents. So my journey in adolescent boys and adolescent goes way back in 1984. Then over the years, when I left my professor pediatrics government service at BJ Medical and joined Bombay Hospital as a professor, I started, because in private hospital it's easy to start an adolescent clinic, and I started a weekly adolescent clinic for 10 years. And when I shifted to Delhi, I worked in Max Hospital, Panchashila and Saket. And then I took a decision that I cannot continue pediatric clinical practice for various reasons, and I joined Indraprastha Apollo as an academic consultant, but I continued my home clinic in Delhi for adolescents. And when I shifted to Pune after retirement, I've been working in Jahangir Corporate Hospital as head of the adolescent clinic once a week. So I've got 38 years of adolescent experience and last 20 years exclusively adolescents. At present, I'm working in 2 medical colleges. I joined as a visiting consultant in Sassoon Hospital, BJ Medical in 2019, exactly 40 years after I had left as a professor of pediatrics. I was specially invited to start the adolescent health services, and we started an adolescent clinic, a weekly clinic, and I trained the entire pediatric department in adolescent health. And it was a fantastic experience, but then COVID came and we got shut down. So last 2.5 years, I'm not going to go to Sassoon. And I've been working in DY Patil since I relocated. And you all know Dr. Shailaja Mane, who's an adolescent expert, and we both have been conducting and seeing cases there. So what I'll be sharing today, this is not going to be a theoretical lecture covering all issues related to adolescent boys that can be found in textbooks or articles on adolescent boys. I'm not going to discuss rural, marginalized, out-of-school adolescents, as I have no personal experience on them, and it will only mean a theoretical review of literature, which I don't want to do. So I'm going to share my experience of various cases related to puberty, sexuality, gender sensitization, neurodevelopment disorders, premarital counseling, legal issues, and sports participation. So what are the methods of my counseling? The classical counseling is telling the client not to do what to do, but helping him to reach his own plan of action. It's a facilitation. Takes minimum 45 minutes to 1 hour per session. Many sessions are required. I used to do this before because I'm trained in counseling, but now with my health issues, I do not have so much energy and time. So I've got a team of counselors and clinical psychologists. Though I'm trained in CBT and REBT, if a client requires such prolonged counseling and sessions, I refer to them. So now I've switched to what is known as prescriptive counseling, preventive counseling, and anticipatory guidance. So let us discuss the adolescent boys' issues related to puberty. Now most girls talk to their daughters about menstrual issues. They also are worried about the pregnancy, so they discuss in detail. Though some of them may put some myths, and that is why it's important to educate mothers about menstruation and the myths. But at least mothers talk to their daughters about menstruation and sexuality. But what about fathers? Are they comfortable talking about issues related to puberty to their children? No. In all AACCI workshops, when we ask this to the parents, very few hands go up. And this is true even of pediatrician doctor parents. The fathers are not comfortable discussing masturbation, night ejaculation, pornography, risk of commercial sex, teaching their son the correct use of condom, etc., etc. So what are the issues of puberty in adolescent boys and the cases I've handled over years? The ones who are early boomers look tall, they look big, so they're accepted as their leaders. They have better performance in sports at the same peers. They are more sexually attractive to their class girls, so they feel very happy, their self-esteem is improved. But they can easily go on the wrong path of aggression and intimidate the younger ones and become bullies. And because they have a body which is now mature, they have a sexual urge. And hence there can be a sexual experimentation without the emotional maturity. And many of them lead into high sexual behavior, and I've got cases like this. What happens to those who are late bloomers? They feel very low self-esteem because of their puny size. Some may not excel in sports. And if they are good in studies at this age, they are not praised. They are called nerds. Academic excellence is praised much later. And many of these boys, when they used to come to my clinic, they used to complain. Ki, Doctor, auntie, girls don't look at me with the way they look at these bigger boys. And most of the times if I express I like them, they say, no, I only like you as a friend. And they're happy to put me as a Rakhi brother. So they're very, very unhappy that they're being late bloomers, they're not attractive to the opposite sex. They're also more likely to be victims of bullying. They're likely to have sexual abuse by the older, bigger boys, and they're more likely to go into steroid and other drug abuse to build up their body. So appropriate sexuality, age appropriate is very important, and schools may not regularly hold session of sexuality education, and the word family life education has been very beautifully termed or coined by Dr. MKC during his President's Action Plan. Most parents cannot or don't talk, so most adolescent boys get wrong knowledge from peers and websites. And a very simple thing like masturbation, which is a very normal process, a very important part of sexual release and safe sex, gives them tremendous guilt. I'm a bad person committing sin, especially if they come from a conservative religious family. If my parents come to know, they'll be ashamed of me. My friends will ridicule me. I can't stop, so I'm a weak-willed person. And there are a lot of myths. 1 drop of semen equals 100 drops of blood, so a person becomes weak. And many of these boys who regularly masturbate actually feel they become very, very weak because of these myths. And that it causes infertility, impotence, they cannot have normal marital life, etc., etc. So we need to answer all their questions. And this we can do one-to-one, or we keep a question box when we go to school programs, which AACCI regularly does, where they can put all the questions without their name and they feel very comfortable. Night ejaculation and wet dreams causes a lot of confusion, anxiety in young boys. We need to explain it's normal and benign. It's a natural way to reduce the stored semen. And Dr. NKC used to beautifully say, what happens if the tank is full and there is no tap open to the outlet? It's going to overflow. So this is what actually night ejaculation means. And we have to explain that they're not pervert, they're not bad boys, dreams have no relationship to reality. And there are various questions which boys have asked me in my clinic. Is there any way I can prevent nocturnal ejaculation? Especially when I go for treks or I'm sleeping out or I'm sharing a room, I get very worried what I will do. So all the queries, masturbation, how much is excess? And then again, I remember Dr. Ingresi told us that masturbation is like an itch. You have to scratch it. But what is excess? When you scratch till it bleeds. So that is why we tell them there's no hard and fast rule as to the frequency. But if it distracts you from your normal activities, doesn't give you time for extracurricular activities, affects your academic performance, you don't have time for anything, it causes recurrent UTI because you're not practicing hygienic things, it causes local injury or inflammation, that means you are doing it in excess. Then a very common question is asked, does every boy masturbate? I had a few boys saying, ma'am, I don't feel like masturbating, all my friends are doing it. Am I an abnormal person? Am I a sexual person? And you have to answer that very scientifically and nicely. If a boy says, I find masturbation painful, we have to take a detailed history and a physical examination because it can be simple, a tight prepuce, which when relieved, the boy will start enjoying the normal activity. Then sometimes very practical tips are needed by boys, and a lot of boys have asked me this question. Dr. Nkezi said boys don't open up, but maybe because I build up to adolescent boys, I find boys open up to me in the first session. So I've never had any problem with boys asking me very, very difficult questions. So every girl is taught by her mother how to remove menstrual staining, whether it's on her clothes, on her bed sheets. Boys rarely wash bed sheets, and so they have a problem what to do when they have a nocturnal ejaculation. So we need to give them tips how to remove the stains. And I have gone to the websites and made links. And normally I share these links with them, which gives them stepwise information, what to do and what not to do when they want to remove these stains and how to wash these bed sheets. Some of these queries are quite amusing but very important for us to answer. If my male friend and I mutually masturbate, is that homosexuality? If my girlfriend helps me to masturbate, does that come in the category of safe sex? Is oral sex completely safe? We have to discuss all this and give them the proper scientific knowledge. Do girls masturbate? How do they do it? Do married men practice masturbation? My friends keep getting nocturnal education very often. I don't. Does that mean they are more sexually powerful than me? Again, most boys are not aware of menstruation. Unless a boy has a sister or a female cousin, or the mother has a rapport with him where she can talk about menstruation, a boy has no clue what menstruation means or what support he can give to a girl or sister or his wife in future. In fact, very often boys make a lot of fun and ridicule girls about their premenstrual tension or staining of their dress, etc. So it's very important to make adolescent boys aware of all these issues, because then there'll be a supportive son, supportive brother, supportive boyfriend and husband. And I think adolescent boys should see movies like Padman, because a macho hero like Akshay Kumar cared for helping his wife and the other women. All the two adolescent experts know that when you're dealing with adolescent, there's a specific psychosocial way of history taking, which is called HEADS assessment: home, education, eating, activities, drugs, sexuality, suicide, and safety. And if you regularly take this protocol, you normally pick up all the flag signs which normally the adolescent may not open up or the parents may not be aware. So just to give an example, if a child comes with failing academic performance, we check the home history, we check his education, we check his eating, his activities, and when we discuss sexuality, we got the clue that he is masturbating daily, the frequency is increasing. Once his mother saw him masturbating but did not react and he has not talked about it. Now this is weighing on this boy's mind. He is now continuously watching and binge watching Netflix using Discord app, and when you talk to him, he then comes out saying that he's very depressed about his excess masturbation. And then once you try counsel him, his failing academic performance improves. So lots of masturbation, ejaculation, if not properly explained, leads to a lot of anxiety and can cause depression, as the boy cannot stop and enjoys doing it. It affects all parts of his life: self-esteem, personality, academics, relationship, family and peers. And in adolescent training, we always say that when a child or adolescent is brought to you with sudden change of behavior and personality, look for flag signs of mental illness, sexual and physical abuse, substance abuse, etc. Over the years, I have learned that in addition to all these, which are very important, you must ask history suggestive of guilt of masturbation. And I've dealt with a variety of cases. And I'll just give you one illustrative case. In Jangir Hospital, when I started my clinic, a obese boy, a single child, was referred by the endocrinologist to me to manage and assess his sudden change of behavior. Brought by the mother, a very conservative Tamil Brahmin family. 3 to 4 months, deterioration in studies, withdrawn, not mixing with peers, keeping his door locked, stopped hugging his mother. Who he had excellent communication, now refuses to confide. Stop doing puja. Now for me, these were flag signs that this is a puberty boy and has he started masturbation. And hence, I developed a rapport in the very first session and said, I can answer any questions and problems, feel free. So he said, for example, what questions will you answer? So I said, at your age, sometimes you accidentally touch somewhere, that gives you pleasure, then you start doing it again and again, and then you feel guilty. Is that happening with you? Then he immediately said, yes, ma'am, and he poured out with anguish. He said, I've been doing it regularly and I feel I'm impure. So I'm not hugging my mother because she's pure and I'm dirty. I don't feel like taking interest in anything. And I do so much prayers and yet God is not helping me. So he stopped doing puja and he said he's a sinner. He wanted to tell his mother because he had such a wonderful rapport with his mother and he took advice in everything that he was very upset that he is not able to tell his mother. So normally we don't insist on telling the mother unless the child wants, and we keep the confidentiality. But this boy wanted to tell his mother. So I said, okay, shall I tell your mother? He readily accepted. So I extended the session, which normally was only for him. I called the mother and when I told her, she was horrified. She said, ayyo, she was a very conservative Tamil mother and she started crying and said, my son is a pervert and what did I do? I failed as a mother. So I calmed her down. I told her this was normal and I told her that for your son, maternal acceptance is extremely important, and once this guilt goes away, he'll settle down to normal life. And I requested her that I will again have a long session with you about this, but today, since your child is so distressed, can you just say that Dr. Bhave has explained me about the masturbation, it's okay, and hug him in my presence. I called the son back in, she hugged him and he just broke down, cried in relief and told her all the feelings. And the smiles on both their faces was a reward. I did many more sessions to reduce his frequency of masturbation and brought him out of depression. Now coming to pornography, this is a real burning problem, and in COVID it has increased. Even adults have become addicted to pornography. Nowadays even girls are watching. Can somebody please mute? There is a disturbance. Please mute. Nowadays even girls are watching porn and they accept it. Many sexual molestations have been triggered by watching porn, especially under influence of drugs and alcohol. And we know these classic cases of the Delhi rape case of a European tourist who asked a group of boys who were drinking and having ganja a place to go somewhere, and they misdirected her, and in a PWD house room they raped her, gang rape. So we have to be very careful what this pornography leads to. My NGO AACCI, we do parent and teacher programs, and we do a lot of awareness for teachers and parents to do capacity building, and we give them case scenarios. How to deal with a situation when your son at home or student in school is found viewing or sharing porn. And we cannot shame them or punish them or prohibit them. What we have to learn is to explain to them the short-term and the long-term adverse effects of porn. And it is important to train them with life skill education to take the right decisions. And it's very important to instill good values at home and school. And role modeling has to be done by adults. It's a very interesting story. Long back, when I first had these boys viewing porn, one or two of them has to ask, I'm just curious, will you give me an honest answer? Who leads you to these sites? How do you manage to get the sites? So I'll share the answer which one boy gave. Auntie, it's very easy. At night, my father watches porn and he deletes. He thinks it's gone into trash. But I know how to relieve deleted items. So all I have to do is to go and retrieve those items. So then I'll end up counseling the father and the mother when the child had been coming to me for porn viewing. So we had to explain to them what happens if you watch too much porn. It portrays women as sexual objects, commodities to be used, can trigger molestations, will go into legal complications. Pornography affects your academic interest, it can destroy your career, which is very important at this age. You can see porn much later when you got a job. No time to nurture other talents, leads to selection of peers that can have other issues like drug addictions, juvenile delinquency. It depicts very unnatural and perverse sexual acts. It affects normal marital relationship. And coitus shown only as a physical act, which is again abnormal, going out for half an hour. And there's no concept of love or lasting relationships. Dr. MKC talked of Newton Lewis. Yes, he's our adolescent boys expert. And this is a slide which he has shown, and with his permission I'm showing. I think it's a very beautiful slide that at adolescents, they are going to try experimentation with commercial sex workers. And we need to talk to them about it because this is curiosity, performance anxiety. And we need to tell them about the STDs, HIVs, etc. And I'm very glad that commercial sex has been legalized. The prostitution, the stigma attached to it and the exploitation, all this will come. But of course, that's a big topic by itself. Now, this was my first case of dealing with porn issue, but I'm sharing you because 30 years ago, when I started my weekly adolescent clinic in Bombay Hospital, I got a distress phone call from a friend who was crying, wanted urgent appointment, said I can't talk on the phone. And when she came to my clinic, she said she was clearing her son's room, dusting the mattress as a routine, and she found our magazines under the mattress. And she was really embarrassed because the maids also saw them. Remember, this was 30 years ago. There was no digital media. Porn was not universal. It was not an acceptable action. It was considered perverse. And seeing those magazine pictures was a cultural shock to me also because I had not seen such pictures. Since she was my friend and the son was my patient, I calmed her down, said, don't worry, nothing serious, we'll handle it. I read up a lot, consulted my psychiatric clinic colleagues, and then I managed to counsel her, successfully did everything. I went to the house and counseled the maid also, because otherwise the maid would have spoiled the reputation of the boy as a perverse boy in the community. Now, recently when I was in Sassoon Hospital in Jan 2020, a mother brought a 12-year-old son from a slum area because he was misbehaving with her 10-year-old sister. So we said, what is he exactly doing? He said he's sleeping on her and doing inappropriate action. So when we did detailed history, this boy had been befriended by a gang of older boys, taken to the terrace, shown porn films, made to do certain acts for the boys, paid money, so it would become like he was earning money with all this. He felt very stimulated at night when those boys were not around, and he started experimenting with his sister. So with few sessions and help of mental health professionals, we found he's making good progress. Unfortunately, with COVID shutdown, I stopped going to Sassoon, so I lost this case for follow-up. So body image and eating disorders, we all know about girls, but they're increasing in boys also. I see a lot of my cases in clinic, and we see cases in teleconsultation. So AACCI has made a special module for body image in school children, And I'm not going to go into detail of each slide, but I'll just rapidly show you what we need to discuss about body image in school programs. So AACCI is my NGO which I started 15 years ago under the chairmanship of my father, Padma Bhushan Dr. Lele. And as you can see in the photos, a lot of IAP members, AHA members are actively part of this. And last 15 years, we have been conducting programs for parents, teachers, students, schools, colleges, community, and now we have added grandparents. So this is the slide which we show where we discuss how body image affects them in various ways. I'm going rapidly. How to get body positivity, how to accept specs happily. This is Param Prashant Karya's son because I wanted non-copyright images. We discuss eating disorders. Very important to make them understand ecto, endo, meso. That if you're ecto, however you try hard, you can't be a big bodybuilder and all unless you take exceptional measures. If you're endo, it's very difficult to have a normal healthy weight. You are going to be slightly overweight. And if you're meso, then you're more likely to build muscles. This is an important concept we need to tell them. We also tell them that you don't follow the current fashion trends and wear clothes which don't suit you because people are making fun of you. So understand your body shape. Choose clothes which bring out the best in your body shape. And don't go by these images which are again photoshopped, and don't try to have steroids and other things. And seeing these beautiful models, most of the boys want a beautiful girlfriend, and everybody in life cannot be so beautiful. So they don't get attracted to normal, average, healthy, good girls. So we explain to them that this is all image, reality is not there. So start loving and liking the girls around you. Now we come to LGBTQ and gender dysphoria. These are emerging issues, and we have to change our mindset and get trained to deal with these issues. In 2004, Dr. MKC Nair and I were invited to Bangkok for a WHO training workshop on adolescent health called WHO Orientation Program. And the first principle we were told, don't be judgmental when you are dealing with an adolescent who is not conforming to your beliefs and values. Don't deal with them through a prejudice. When you see an unmarried teen girl, a STD, a substance abuse case, deal with them as adolescents. You have to help. And this is what I've carried forward since 2004 to date. You need to get trained to handle such cases. I've read a lot over the last 10 years. I've undergone training courses. I've worked on many such cases with a team of psychiatric counselors over the years. And now I feel confident in handling these cases. But still when a case comes, I don't handle it alone. I get my team of experts. So those of you who have recently started adolescent practice must understand these are very sensitive and complex cases to handle. So get trained and team up with experts to handle these cases jointly. Otherwise, you can do a lot of harm to the adolescent and family. For example, one adolescent person told the family that you can change the orientation, don't worry. So they went to a Baba to change orientation, and this Baba sexually molested the adolescent boy. So be very careful what you're telling them. Now, a lot of movies and TV serials are showing these relationships, and adolescents are not quite aware. What are the cases that come to me by parents? Is our son gay? They feel he's very feminine, does not have girlfriends, or they are found overtly physical with a cousin or a male friend, or he is continuously talking about rights of gays. Or recently they came to know about someone's friend in a family, and now they want to know what sign should I look for in my son to pick up if he has a different sexual orientation. How do I get in the clinic? In the health interview, we can get an inkling about sexual orientation while taking this history. When the adolescent has been brought for other issues, like depression or bullying or failing academics, substance abuse, etc. Sometimes, after developing rapport, the adolescent boy himself opens up. And then there are a lot of questions. I feel I'm a homosexual. How can I be sure? And you need to have scientific protocols to answer this question. I've had same-sex experience. I'm confused. I don't know how to tell my parents. Do I need to tell my parents? My father will throw me out of the house. I'm very scared. How can I face my mother? She'll be ashamed of me. I've developed feelings towards my best friend male, but I'm worried how to tell. Will I lose his friendship? My friend has taken intimate pictures of us and now he's blackmailing me, and I've handled all these issues. I feel I'm bisexual. How can I be sure? I've had sexual experience with both sexes and enjoyed it. What should I stick to? One or follow both? I've also had cases of gender dysphoria, which are far more complex and difficult for both the doctor, the patient to handle. I've got cases referred from school as the boy has been caught in inappropriate behavior with another male student in the class. I've got cases which have legal implications, where the perpetrator is an adolescent but doing acts with a younger boy. These are very complex issues that require police and judiciary involved. Going to gender dysphoria, I don't know how many of you have seen the movies Chandigarh Kare Ashiki. If you are not, please do see it. They have very beautifully handled the cases of gender dysphoria in a very nice way for lay public. With recent advances in knowledge of the subject, there are well-defined protocols to deal with gender dysphoria presenting at various ages, right from the age of 3 years. Gender dysphoria cases are managed with an expert team, pediatrician, adult physicians, psychologists, endocrinologists, geneticists, etc. I do teleconsultation with Dr. Anagha Jaikar, who is in Australia, who is an expert on this subject. She was professor of pediatrics at Nair Hospital before she migrated. In the year 2019, we conducted an international advanced training workshop at DY Patil with Western Michigan University. Many of you attended that, and we all remember the wonderful session she conducted for us. But this was not easy in the past. A senior pediatrician in Nagpur was managing a male child from the age of birth to 16 years who showed signs of gender dysphoria. He would be constantly discussing this case with me off and on. He was from a very rich Marwadi family, a third child after two sisters. His father was grooming him to take over the business empire. His mother was aware of his feelings that he was a girl trapped in a boy's body. Tried to tell the father, who had a violent reaction. Thereafter, both son and mother discussed with each other but never raised the topic with the father. When he was 16 plus, he shifted to Pune college, so I took this case for management. By now, he was quite sure he wanted a gender change. He had enough money, went to the net, looked for a Bangkok clinic who would start hormone therapy on him even the long distance. So then I had lot of efforts to counsel him, wait till 18 to 21, persuade him to take a psych evaluation, follow the protocol which is done stepwise before surgery is undertaken, talk to parents, brought them to Pune. Mother was on board for a long time, father just would not accept, ultimately accepted the son's decision of surgery but cut him off from his life. And I only hope that he'll soon accept this beautiful girl, but difficult because he already has two girls and he wanted a son. You all know that neurodevelopment, autism, ADD, CD, ADHD are much higher in boys. And then they have special challenges of peer acceptance, self-esteem, vulnerable for bullying and teasing. We all know ADHD have high risk for drinking and driving, gaming, addictions. They have lack of empathy, especially if autistic, and these lack of social skills make them victims of social isolation, discrimination, abuse, difficulty in fitting into the mainstream, so psychosocial problems. They may not be able to finish their education, so unemployment, conflict with laws, becoming juvenile delinquent, joining gangs. So we regularly conduct life skill education for parents and adolescents, both of ADHD, CD and ODD. This is our Nagpur sessions for parents. I had a doctor friend of mine who had a 20-year-old autistic son. She had trained him to express his feelings of love and happiness by giving her a hug, saying I love you, and give a rose or picture. He was a handsome man with a child's mind. One day there was a complaint from the neighbor and a FIR was lodged and the mother gave me a call to come ASAP. Their neighbor had a 13-year-old girl who this boy liked. They used to talk often and on. That morning, he gave her a hug, told her I love you, and gave you a rose. I had to have a very long talk with the neighbor, explain to him the scenario, request him to withdraw the FIR, which fortunately he did. I assured him the boy would not repeat his behavior after training and counseling by me, spent lot of sessions to explain to him how he should behave with a girl or also with a boy, taught him the do's and don'ts of what to say, what not to say, told him not to touch anybody, literally took a doll, showed him the physical boundaries, and like you teach good touch and bad touch to small children, I taught him that what will be good touch and bad touch if he touches an adult girl or boy. I still take reinforcing behavior, and I feel very sad when I see this handsome boy with a child's mind requiring this sexuality education repeatedly. Now, when you talk of choice of career, it's important for girls, but we all know that still in our patriarchal society, boys have a much harder time because the parents are looking forward for the boy to carry on their genetics and carry on their profession. Career choice is a big stress, major cause of psychiatric problems. A lot of parents need to be supportive. You need to have career counseling, psychometric tests, etc. And this is really something which both parents and adults require counseling. So the cases which I've handled are doctor parents forcing son to be a doctor to continue their hospital, professional parents not able to accept their career choice or what they feel very inferior, being a DJ or a VJ or a dancer or a chef or a painter or a singer. Boys accepting their parents' career choice under pressure and wanting to drop out midway through medical or engineering courses. And I'm very happy and satisfied that I have managed to make a large number of children complete the engineering and the doctor course, saying, better you already spent 2 or 3 years, finish that 1 year, at least you'll have that graduate degree. You can always change your course. You don't have to continue being a doctor or engineer. But if you midway stop, you're in the market only 12th standard. And most of them have completed. Some of them have continued the profession. Some of them have changed their profession. I've also handled a lot of fear for appearing for CET or NEET, which just 1 week or 1 month before, most of them are fellow pediatricians or doctors' children. Social media, internet addiction, gaming addiction, cyberbullying. I'm not going to discuss much of these issues because most pediatricians and adolescent experts have handled these cases. During COVID, incidence has gone very, very high. Just yesterday, we had the horrifying case of a boy murdering the mother on PUBG issue. We saw how remorse-free he was. He said, I don't have any remorse of killing my mother. How he kept the body there for 2 days and kept his younger sister crying and kept feeding him. So I'm not going too much on this topic. In 2012, AACCI conducted a national consultative meeting for prevention of violence and bullying, and we had Dr. Shekhar Sheshadri working with us for 3 days, guiding us. We had psychiatrists from all over the country. We had 50 principals and teachers, and we have come with very beautiful guidelines. We have come up with 4 modules for prevention in children 1 to 4, 5 to 12, teachers, parents, etc. And these are free for use. Any of you want to get trained under AACCI for these training program, please contact me. We will be happy to train you. We have already started these training projects. Another thing which I would like to share is juvenile delinquents. After knowing all the work I have done on anger, violence and all, I was invited by the Juvenile Justice Committee for doing a project in a remand home where there was a lot of violence and arson, where the boys had climbed on the terrace, burned gas cylinders, etc. And with a team of psychiatrists, counselors, etc. And Dr. UNB Rao, a police officer who lost his son at 18 years to a tragic motorbike accident and started a Urvi Vikram Charitable Trust. We worked for 1 month assessing these children and suggesting interventions. And we were given, first month was voluntary, second month they paid us to again do something. And then they were so happy with us that they gave AACCI a 2-year contract to work with juvenile justice children and improve them. But due to my frequent relocations, there are some of my dreams which remain unfulfilled. And this was one dream which I had to give up. I could not do this project. This is whole experience which will take 1 hour to share, but it gave me an insight into the life of juveniles. Each story of those 20 boys who had come there for rape, murder, armed robbery was heart-rending. It was like a Hindi movie, how Amitabh Bachchan became a criminal. And it was very sad that 20% of them had undiagnosed mental illnesses. 50% had ADHD, CD, ODD. And had mental health intervention been done for these kids at the right time, maybe they would not have been juvenile delinquents. And I'm just sharing these pictures, for example. Yes? These are pictures like one boy wrote, cigarette and sarab means life totally kharab. So that means he was aware that these are bad things and we could change him with counseling. See the other boy who said, Jat is frisky after whiskey. Or peene ke baad, Royal Stag, we are not responsible for our actions. So you will require intensive counseling because this child already has this belief that if I drink, if I take drugs, I'm not responsible for my action. And this is a letter I treasure, which I got from the Juvenile Justice Department for the short work of 2 months, which I did in Delhi. So we are now starting this new project with AACCI, Protect Yourself ABC, No to Anger, Bullying and Children. And those of you who want to join are welcome. We already had one TOT on 8th June. We are having a second TOT on 15th June. Now, what shapes up an adolescent boy's personality? During my premarital counseling, I found a large number of issues girls face in their marriage are directly related to how their husband was brought up as a boy. And so the husband is not able to perceive this as a problem at all. So when the wife complains that he is not supportive, he is not helping, he doesn't think it's a problem at all. Because how have they been brought up? If they've been brought up as a gender stereotyping that a man does not help in the household duties, especially if they are servants to help, and home and babies are full responsibility of a mother, and they are only there for financial and major decisions and making the rules. So these men do not even understand that they are living in a new world. Fortunately, COVID has lockdown has changed all this, and realization has dawned. Without servants, every man who has stayed at home has understood what a woman, whether she's a housewife or a working woman, does 24/7. Otherwise, just to feel din bhar kya karti hai baith ke. And we need to bring up both our girls and boys to play a balanced role at home. In nuclear families of today, when the young couple has no family support, it is necessary that the man becomes supportive to his wife, more so if he's working. If this is ingrained into an adolescent boy, he transition into a role of a supportive husband very naturally, and the marriage will be smooth. But if he does it under pressure from his wife and his family, and he's not trained to enjoy it, it leads to marital divorce. And so many divorces have happened because of this. Our girls are emancipated, empowered, but unfortunately, our adolescent boys are not trained and have no clue how to handle these emancipated women. And I've done a lot of counseling for adolescent boys and their parents who feel, why is that wife making my son make tea, making my son do household work? I never made him work for the last 25 years of my life. And who's this girl who's making him work like this? How women are treated in his home and surroundings shapes how a boy will behave with his wife in future. If his mother, grandmother, other women in joint family are disrespected, regularly castigated for small mistakes of action by the men of the house, this is the role modeling for him. This is how I treat a woman. If Eve teases accept in the community where he's brought up, it's a way of life. And if you all see the Hindi movies, especially Shammi Kapoor, the way he woos the heroine, it's actually sexual harassment in today's world. So if a boy is a single child, if a boy has a male sibling, if a boy does not have much opportunity to mix with female girls, boy has maybe male friends, he does not know, as MKC rightly said, he doesn't know how to behave with a girl in an appropriate manner, and often he's scared and he withdraws. And are men and women wired differently? Is it all nature and you need to accept it? There's enough research to show a lot of differences in the male and female brain, like a woman is better in multitasking. But many feminists believe this is a myth, and all this depends on the nurture part, where gender stereotyping makes woman's brain think differently. And if a woman is brought up to think and behave like a man, she will do exactly the same. I'm not going to this debate, but I believe that men and women are wired differently, and I've read a lot of these books of why Mars and Venus collide, men are from Mars and women are from Venus. And I suggest those of you who have not read this book and you're having a difficulty with your spouse, please read these books. It will make you understand how a man's mind works and how a woman's work. And especially in my marital and premarital counseling, I make the husband and wife read these books, and I found this very, very useful and effective. For example, when a woman asks the husband, am I looking fat? Is this dress suiting me? She very well knows she's looking fat. And there are enough people who are going to tell her she looks fat, this dress is not suiting her. But she wants from her husband a sort of confirmation. She wants her insecurity be handled. And an honest husband who answers very honestly, yes, you're looking fat, you're looking bloated, you better reduce, is going to shake her up. And she'll feel the husband has no empathy. So you have to give the diplomatic answer that yes, you have put on a little weight, but you still look so beautiful. And don't worry, this dress is suiting you. Last 10 years, I am doing a lot of pre-marital counseling for children in friends and family. We have also done teleconsultation. Pre-COVID, we have done college workshops, how to choose your life partner. And we ask them, what are the things you look for in your boyfriend? What are the things you look for in your girlfriend? And they make these charts, what they like about their boyfriend, what they like in their girlfriend, wearing very always being groomed, wearing branded clothes, spending lot of money, does not like to sit at home, wants to go out all the time, very jocular, doesn't take things seriously, does not force me to mix with his family. All the other girls are after him, so I feel very proud about a boy who's after him. All these things, when it becomes a husband, becomes difficult. Then the question comes, he's irresponsible. He has no financial planning. He flirts with the other girls. He's forcing me to mix with his family, etc., etc. So we had done this study in 2018 with the first year engineering college girls in Pune Engineering College, and it was very interesting to get the inputs for them that they prefer a husband who does not expect financial assistance from his parents. They don't like this dowry and ghar jamai, and they want a husband who will allow her to look after the parents after marriage. Today in our patriarchal societies, a boy continues looking after his parents even financially. But a working woman, when she gets married, is supposed to give all the salary to the sasural. And if she wants to help her parents financially or otherwise, it is not accepted. And hence, today's girl want that just as a boy is allowed to help his parents, the girls also should be allowed to help her parents. And many boys are worried about their body image. But from our thing, the girls are not so much bothered having a good-looking husband, but they want a partner who's exercise fitness, who exercises, who does not smoke or drink, who eats healthy, and who supports their career after marriage. I'm a champion of women's rights and salute all the laws made for protection of women. In all our programs for adolescent girls, we empower them by giving them the knowledge about their rights and laws that help. But we also have to be aware and make our adolescent boys aware of the laws and how they can be misused against them. Our laws favor females, and the onus of proving oneself innocent lies on the males. And I thank Swathi for giving me this point. Madam, please include this. Unless made aware, the adolescent boys can be innocent victims. And we know, unfortunately, of a lot of cases in our own friends and families, how the Dowry Harassment Act, how the Domestic Violence Act, or how the Sexual Harassment Act in the workplace has been misused, and how some innocent men have suffered. So we need to make adults and boys that be careful that these laws can work against you. And boys need to be made aware of the implications of the POCSO law. Sexual act between two adolescents below 18, even if consensual, is punishable. Any sexual act between 18 years below is rape. And when two teens run away and elope, and if the girl is a minor and the boy is 18 plus, it has serious implications. The girl's family can put a FIR for abduction and rape. Sexual harassment laws related to work also have serious implications, and men need to know that these laws are horrendous. It can mean 15 seconds or more looking at a woman inappropriately. So you have to be very careful what you do. Now, I worked as a medical consultant for Karate Academy in Bombay for 10 years, as to give fitness certificates for sports for 10 years. So I have a lot of experience of adolescent sports related issues, and I wrote a book along with Dr. Dilip Patil and Donald Bredanis, who are sports experts. And my son was a national level TT player, and my husband was a national level swimmer. So I have a lot of experience of handling sports issues, and I was a sports captain myself. I participated in the NCC parade in 1966 from the Maharashtra contingent. And adolescent in sports is a big subject by itself. And here you see the photo of my husband with my son, who was 3 years old, who was a badminton expert and a national TT player, and both my sons were karate champions. So what are the case scenarios of adolescent boys related to sports? I had a famous sports person, a cricketer, whose son was very good in cricket but did not want to follow cricket. And the father brought me for counseling. And the son was very rational. He said, Auntie, however I excel, I'll always remain under my father's shadow. And I don't want to go down that path. I love tennis and I'll be a tennis player. So I persuaded his father. Today he's an excellent national tennis player. There are some talented adolescent boys who do not have the killer instinct to get past the semi-finals. So they just give up and they don't reach the top, and that creates a lot of frustration. This is sports psychology. So I had success in some, where I got the killer instinct, and in some where they just could not have the killer instinct, I persuaded them not to keep crying on the court and give up and try something else. I've seen adolescents with anabolic side effects, kidney overload with high protein supplement. I've seen star burnouts when they become stars at that adolescent age, when they are, for example, early puberty. A boy is very big in peers, so at the age of 10 to 15 he stands out, and then everybody becomes the same height and weight, and then he's no more a star, and he finds that very difficult to deal with these failures. And steroid side effect, we must teach our adolescents, we must tell our parents and the athletes who are doing this, and sexual abuse by the coaches or the older athletes are very, very important. What I could not cover in today's lecture due to constraint of time, because I like to keep to time, are issues of consent and confidentiality, which is extremely important, because when you deal with the adolescent, the parents are paying their money and they have no concept of this. And the moment the session is over, you'll get a phone call saying, "Kya bola? Please let me know, what did he say?" So right at the first, we have to explain to them that whatever I speak to your son will not be told to me, to you, even if you're paying, unless he gives me permission to tell you, or I feel he's going to harm himself or society. Mental health issues is a huge spectrum in adolescent boys and girls. It has increased in COVID times, but I could not cover this. Substance abuse and PTSD, and very, very interesting cases related to the POCSO Act, implications on consensual sexual relationship between consenting adults. Maybe some other lecture we can take this up. I would like to acknowledge, I always believe in teamwork. I always believe in peer review. I acknowledge Samir Shah for the graphics. I normally prepare a week in advance. I prepared this lecture yesterday morning and gave it to these three people who spent their time and gave me a feedback by night: Sangeeta Yadav, Prashant Karya, and Niti Soni, to reassure me that yes, you have covered all the points. Swathi Y Bhave for suggesting inclusion of career and legal handicap for men, and Newton Lewis for allowing me to share that beautiful picture of commercial sex workers. And I would like to thank my family, because my two adolescent boys, bringing up them was a real pleasure. And when everybody else used to complain about the problems, I was blessed that I had such a rapport with them. And I'm blessed that I had a husband that when I told him that I'm a mother and a doctor, but there's still some things which I may not be able to explain to my sons. And there's a difference between two kids, you all know. My younger son was very open with me and would discuss anything on earth. Whereas my older son always felt, "You're my mom, you're a woman, I feel little inhibited." So I told my husband that we train fathers how to talk of sexuality issues. So he said, "Fine, you train me and tell me what you need to talk to my son." And he discussed every issue with my older son, for which I'm grateful, and I could discuss with my younger one. And before I log off, I would like to share a story about my younger son. My younger son was 6 foot tall, very tall and handsome in his college. He was sports secretary. Lots of girls were after him, and he had a big group of girls and boys, but he didn't have a girlfriend, whereas most of the other boys had a girlfriend. So my antenna went up, and I felt as a mother, I must find out. So I sat with him one day and said, "Why don't you have a girlfriend? And are you attracted to other boys?" And I said, "Mom, don't worry, I'm not gay or something." Then I said, "Why don't you have a girlfriend?" He said, "My fundas are very clear. First, finances." He said, "I do not understand why a boy has to take a girl for a date and pay for it. Because these girls come from rich families, their parents give them equal pocket money. So if you give me limited pocket money, I would rather spend it on myself. I don't want to share." Second, he said that I'm seeing my friends who have girlfriends, and I'm not seeing a very happy experience. For example, one of my friends' girlfriend is very possessive. So he continuously keeps tabs on him, and he constantly has to tell her where she is. I don't lose my freedom like this. The other friend, his girlfriend is very, very jealous. The moment he talks to another girl, she gets jealous, and half the time he spends saying, "Sorry, sorry, sorry, sorry." So he says, "I want a very nice and happy life. I want to enjoy. I have lots of these girls who are my friends. I don't need to have a girlfriend." And he had a role model of my husband. We both fell in love when I was 15 and he was 18. He said, "I will fall in love with a girl and she'll be my girlfriend and I'll marry her." So he continued this through his 4 years of engineering college. And when he went to USA, he found a classmate in USA who happens to be a Maharashtrian girl, and he fell in love, and today has become his wife. And my older son is a very conservative boy and had an arranged marriage. So Both boys are different. You have to deal with them differently. So all my adolescent experience parenting is due to my husband being a wonderful father to my adolescent boys, and my two sons who always made my adolescent parenting a great joy. Thank you so much.
That is wonderful. Is MKC around? MKC? She's not around. Tell me, Swathi, the lovely talk. There was a chat session on what do you do with a child when adults and boys involved in POXCO case?
I didn't get it. Can you repeat?
POXCO case, when adults and boys involved. A lot of children are being now involved in POXCO cases. Because, they had a bad case, like 5 adults are involved.
Actually, this is a very difficult issue, Jason. I have a lot of talk with Foxy experts, IMA experts, and until we all come together, the Foxy chairperson, I forgot his name, he has made a petition that we have to change this law that consensual sex below 18 cannot be considered criminal activity and rape. Because normally we are talking of giving sexuality education, we are talking of dealing with safe sex, we are talking of ABCs of relationship. And if we ask a boy or a girl below 18 and they give us a sexual history and then it becomes mandatory for us to report, it is a very, very complex situation. And frankly, there is no answer until this law is amended. In fact, I nowadays, when I take this history, I take care not to note it down because I don't want to be caught. Or I don't take the history if I feel it is not mandatory. So I think, Jason, all of us in AHA and IAP who are adolescent experts, we should team up with Foxy people because they also handle these issues, and with IMA, and we must make this change that unless it is a sexual abuse, unless it is a rape, unless it is criminal, consensual sex of adolescents below 18 should not be considered a criminal act. And it was not in the past. This was an amendment which was brought due to various NGOs, and I think we need to fight it.
No, the issue is that these children are joining with others, and the adults are also involved, and then it becomes an issue. Because,
no, if they're involved with adults, it's sure sexual abuse. I mean, any adult having sex with somebody below 18, there's no question of consent. It's sure pure and simple rape. And that's why when the 16-year-old girl comes pregnant, when the Foxy people, we have had a lot of discussions, I've attended panel discussions with Foxy, they have to report it. Because a 16-year-old girl is rape, even if it was consensual.
Now, what about obsession with that masturbation? I had a child who asked if I.
Okay, Jason, I'm not able to hear you really well. Can you put the volume a little better? Not able to hear you clearly.
If an adolescent says that I have masturbated so much that I feel that I can't have children, I have lost all my sperm. What do you explain? How do you explain that?
Actually, I show them drawings and I show them how millions of sperms are being continuously manufactured. And even an 80-year-old man can get a woman pregnant. So he does not have to worry about sperm wastage or not having able to produce a child. And I think all of them are now seeing these diagrams and all that. And if you scientifically explain to them, they are reassured.
Yeah, so that's something you have to explain to children that it doesn't matter, that masturbation is normal. Well, how do you explain that to children?
See, normally what I explain that there are certain pleasure points in the body. And when you touch these pleasure points, you feel good. And these happen to be the genital organs. And normally when you touch them, you feel stimulated, you feel happy. And this is a sexual release. And it is much better to masturbate and give sexual release than go and molest somebody. And as long as it doesn't distract you from your daily activities, from your studies, and it is not causing you harm because you're taking care to wash your hands, you're not getting urinary tract infection, you're not doing it so much excessively that you're getting local injury or inflammation, it is within normal limits. But I also get boys, as I said in my lecture, who don't feel like masturbating. And that is also normal because sexuality is a big spectrum. And from a scale of 0 to 10, sexual urges are different. So somebody may feel like masturbating many times, somebody may feel not doing it at all, somebody may doing it once a week. All that comes in the normal spectrum. And they have to assure to them it takes all types of people to make this world.
No, when masturbation, see when the CD, this pornographic CDs being circulated in schools, how often have you encountered these problems where children are just, they're addicted to masturbation and they're
We have had principals who have called us, who have caught boys doing this. And the famous Delhi case, if you remember, in one of the DPS schools, a boy had a video taken with a girl performing oral sex, and it went viral. Now, these are the things we have to take sessions first for the principals and the teachers, explaining things to them and the parents. And I have had sessions specifically for the boys and girls who have been caught in such acts, a one-to-one session, a group session, explaining to them what are the repercussions.
Now, what about you said about sexual orientation, male sexual orientation. Well, how do you explain to children when they feel that they're not males, they're females? Well, how do you explain to boys that, that this is normal?
See, if you go to gender dysphoria, there's a protocol how to deal with it from childhood.
I don't think people understand what gender dysphoria.
Okay, gender dysphoria means that you're not comfortable with the gender which you are born with or assigned to you. So you feel you're a man trapped in a woman's body or a woman trapped in a male body. So what happens is that this gender dysphoria may manifest as early as 3 years when the gender identity comes first. And I've had cases where when you say, are you a girl or a boy? The girl says, I'm a boy. And any amount of effort told to her, no, but you're a girl, doesn't satisfy her or him. So it can start as early as 3, or it can start during puberty, when that person who's starting getting the secondary sexual organs is extremely uncomfortable having those puberty signs because they do not want those secondary sexual organs. And many times you can see in childhood that a boy having feminine tendencies or a girl having masculine tendencies. So it's a huge spectrum, and age appropriate thing has to be given. And many parents do bring these children, and I've had pediatric cases where can you please mute somebody? Can somebody mute, please? Yeah. So how you handle gender dysphoria depends on the age which the child has brought in. Because if a 3 or 5-year-old child is expressing this, it is not necessary that it is going to last for life. It's a flag sign. So you tell the parents not to oppose it too much, not to encourage it too much. Let it flow and see how things come. But when it comes to around puberty and the child is extremely distressed, then you have to take a team of experts. There's a psychological evaluation. There's a clinical evaluation. There is also a chromosomal analysis. And if this boy or girl strongly feels, I do not want these secondary sexual characters, then you can do what is known as puberty blockers. Fortunately, these puberty blockers are reversible. So you allow some years to go with the puberty blockers while you assess the psychology of that boy or a girl, and then you are sure how much really his gender dysphoria is there. And there's enough protocols, there are enough evaluations which make you understand, yes, for him the distress is real. And if he is not allowed to change his gender, he will definitely be a very distressed and a psychiatric individual. So once that evaluation has been made, the puberty blockers are continued. And then once the child becomes 18 or 21, and again a psych evaluation, everything is done, because before you go for mutilating reconstructive surgery, which is generally irreversible, a lot of psych evaluations, a panel is kept who have to sort of certify that they are very sure that this boy or girl has classical gender dysphoria and he needs this surgical reconstruction, without which he will not be happy in life. And then the genital that means if it's a boy, the removal of the penis and the testicles and creating of a vagina and giving him hormones for development of the breast. So this boy is going to remain a sterile female because he is not going to have the ovaries of the uterus. But he has a vagina, so he can have normal so-called sex. And also, how many of you saw that picture, Chandigarh ki Prem Kahani? They have shown it beautifully. how he does not know that this is a gender transgender female, and how he suddenly withdraws from that girl whom he loved. And later, when the doctor explains to him that you loved her, that time you didn't know she's a changed person, and now you know it, so what? And he accepts her in the end. So it's a huge spectrum, and Dr. Anaga Jaikar, she gave us a beautiful session in ITPA, that the advanced training program. And even today, when I get gender dysphoria cases, I do a teleconsultation with her, and we discuss all this together. And I'm handling cases only because of her, and I've got one or two psychiatrists. So gender dysphoria is a huge complex issue, and we are not trained to handle it. It's much easier to handle different sexual orientation. That means homosexuality or lesbian or bisexual or this. But gender dysphoria is a very, very special section which requires a lot of training and lot of assessment.
Now, this in ambiguous genitalia, who decides what sex you do we?
See, normally when a child is born, and if the sexual organs are not ambiguous genitalia, and they're clearly a male organ or a female external genitalia, then obviously the doctor who delivers or the pediatrician will assign sex at birth. But if there's ambiguous genitalia, again there are protocols. How you tell the parent, what you tell the parent, how do you do the test, at what age, then you have to chromosomal analysis to see what is the chromosome XX, XY or XSY. So again, assigning sex to ambiguous genitalia is a huge thing. And I remember learning this from Dr. Josna Kirtane, who's professor of pediatric surgery at JJ Hospital, who was an expert on ambiguous genitalia. And I got a lot of training from her, how to deal with parents, how to deal with the child, and what protocols to follow.
Because Dr. Karthika Verma, who's a senior pediatric surgeon in Calicut, he says that he's made a lot of mistakes. So when the child becomes an adult, he says, "Why do you raise me up as a girl or a boy? I need to decide." So when is the time so he's had a lot of cases, and he says that after all this experience of 50 years of practicing pediatric surgery, he feels that he should leave it to the child to become an adult before he decides whether it's a boy or a girl.
Of course, because parents, like for example, I discuss my case. See, the parents cannot decide that I want my child to continue as a boy or continue as a girl. Or because he got ambiguous genitalia, I wanted a son, so he should be a boy, or I wanted a daughter, he should be a girl. And the adolescent has a right to decide what gender he should be assigned. And that's why ambiguous genitalia requires a lot of follow-up, a psychosocial support, and taking the adolescent into confidence. And normally this happens around puberty, because that is the time when the secondary sexual characters come up, and that is the time the adolescent has some sense as to what he wants to be, a boy or a girl.
How do you give this boy a feeling that he is the person who decides in a relationship? See, because now you said that boys are scared of girls. You said something like that. You said something in your talk that boys are scared of girls and they have difficulty in...
Okay, MKC also said the same, and let me put it this way. You saw the movie Pink. Yeah. No means no. But the point is, at what time can the girl say no, and what time the man should stop? When he's almost performing the act, is that the time to say no? Or is the time to say no before the foreplay starts? Very, very complex issue, Jason. Because when it becomes consensual sex and when it turns into rape, totally depends on that man and the girl. None of us can decide that. And it's a very, very complex situation.
Now, how did you explain when the child has done his MBBS, so he wants to be a sports coach, and he feels that he doesn't feel that he's good for being an engineer or a doctor, he must be a sports coach. How do you explain to the parents that that's the decision that the child...
I didn't get your question. Can you say it again? Sports coach what?
I have patients who have finished their MBBS or finished their engineering. They finally said they're not happy with that profession. They want to become a sports coach. They're good basketball players. So how do you explain to parents, that that's the decision that the child makes is right, and it's very difficult for parents to agree.
I will tell you, I've handled many of these cases. There was a very close friend of mine who was a doctor couple. Their son was in second MBBS, and he suddenly decided that he will become a sadhu. He'll become a guru. He went to Trivandrum, he attended some 15-day course, and then he felt that I should be a sadhu. So the parents went horrified. He said, I'm going to be a sannyasi and all that. And he wanted to give up medicine. And I handled this guy for 3 years. And I brought him to complete his medicine. Because I told him, you can always be an Adhyatmic guru, but if you're a doctor, just imagine if you combine your medical knowledge and spiritual knowledge, what a fantastic guru you'll become. So complete your medicine. And then the parents said, we cannot accept my son being a guru. So I said, you have no choice. If he wants to become guru, at least let him become a doctor and a guru. And today that boy is a spiritual guru and a doctor. So ultimately, we have to let the boys do what they want. I remember a professor of gynecology whose son got 99% that time, but said, I don't want to become a doctor like you. And he decided to be a chef. And he went to catering college in Mumbai. And this father, who was a friend of mine, used to say, I don't want my son to be a waiter. I'm a professor of gynecology and my son being a waiter. So anyway, I persuaded him. I managed to put them on board. Then this boy went to New York and became chef in one of the New York restaurants. And then the father felt, okay, my son is somebody. So when these children want to do something which is totally against the parents, it requires a lot of counseling for the parents to say that your children are not your property. You can guide them, but you don't own them. And you can want a particular profession for them. But if they don't want it, you have to accept it and allow them to go on that path. But I've done also things, Jason, I've got these 10-year-old guys, who suddenly did a video. And he got a lot of praise for it, he got a prize. So suddenly he told his parents, I'm not going to appear for 10th also. I'm a video guy and I can earn tons of money. I don't even want to do 12th and whatever it is. And he stopped studying. So these parents brought to him. So I had to handle him over 2 years. And I told him, you got excellent video skills, fine. But if you don't have a video graduation, then your market value is zero. And if some big multinational companies want somebody to make a video, they'll go with a person with a qualification. So right now, you continue your video making as a hobby. You finish your 10th and 12th. I helped him to do net search. I helped him to find out computer graphic courses. I guided him over 4 years and he continued and he went abroad and today is a filmmaker. But I told him that if you give up your 10th, you're on the road. Just because you think you have done video doesn't make you stand on your feet. And your parents are not going to support you for life. And no girl will marry you when you don't earn. So that guy today is a filmmaker. But at 10th, he has decided to give up everything, give up studies and become freelance video. So you have to give the right counseling at the right time. These guys are so passionate and so idealistic and their dreams are so big that you have to make them see the practicality also.
Thank you. Do you find body issues in boys?
Very much. Are there some questions you want me to take from the chat box?
Yeah. How do you help teens handle
boys? No, I'm telling you today, in the past, boys rarely had body image issues. But after I remember, I did an NDTV show. I used to do NDTV shows in Delhi. And we had these on-the-spot questions. So there was a 12-year boy who asked me, Auntie, I don't want to grow up. I don't want hair on my chest. I want to be like, Shah Rukh Khan and Hrithik Roshan, how they have no hair on their chest. And how do I remove them? So I told them, and I had, on this open TV show, I had explained to them how hair are natural on a body and how it's okay for men to have hair. And in case he wants the hair removed, his mother and sister can help him. So body image issues are great. And today's, some boys undergo waxing. And we all know as women how painful waxing is. But they want absolute clean chest, clean hair, clean hands. They are not ready to accept that hair is normal. And this is all because of the movies, because of the serials, because of what we see. And you remember we had Fair and Lovely creams only for girls. Now we have Hair and Lovely creams for boys also. So naturally, I always tell in my sessions that if this fairness cream worked, all Indians, we would be fair. Our color is very pakka. It doesn't go. We have to accept our dark, black, brown, whatever color and not waste our time on these skin creams. Because all these ads, for see, example, Clarisil or these ads, one pimple, they make the person feel as if the life is destroyed. And if you wear a fairness cream, you can become air hostess, you can become doctor, you can be anybody. So this is the media impact on teenagers today, the body image. We need to what is known media literacy workshops, demystifying ads And we do a lot of AACCI workshops where we show them ads and we show them how the ads are created by people who understand adolescent psychology and how they know it will have an impact on your brain and how you should demystify these ads and get away from the effect of ads. You remember those, just now there's a controversy going on that spot hotshot?
Yeah.
People have done. So these ads have a tremendous effect on the adolescent mind. And we have to work as pediatricians and adolescent experts in having sessions after sessions to demystify ads and remove this effect of media on them.
Dr. Geeta Patil asks, how do you tackle sexual abuse in boys?
What are these questions? Acha, 1 minute. How do you handle, madam, what do you think is the right age for parents to talk about sexuality to boys and how you help teens to handle failure? Okay. I give a lot of lecture on sexuality to parents and I discuss on age appropriate sexuality education. Frankly, it starts from birth. You know, right from the beginning, below the age of 1 year, we sort of create a little of anxiety about sexual organs. When a 1-year-old child or toddler comes in the room, Nangu, we'll all laugh and clap and say, Nangu, Nangu, go back, making him ashamed of his genitals. So right from the, and we don't even call them genitals. We call them various names, you know, Pangu, Pangu and all those things. So a child grows up thinking that's something to be ashamed of his genitals, especially boys since they're exposed. So we have to tell parents that you should not make your children ashamed of their genitals, but you should ask them to cover them for 2 things. One is these are delicate organs and they can be trauma. Second, they can be infection. So covering the genitals is not out of shame, but out of protection. So that's the first thing you learn to think, that you don't make them ashamed of their genitals. And then as they grow a little older, we start telling them difference, especially at 3 years when they understand boy or girl and how a boy can be different from a girl. Because when they go to school, they see girls sitting and urinating and boys standing and urinating. And that is a big question mark for them, that why a boy does it differently, girls does it differently. And that's the time you can explain to them because the organs are different. And age appropriate sexuality education. Never tell too much. And this is a question I always say, don't tell what is not wanted. I had a pediatrician, this story I've told many times, but it will be new for some of you. When I was in Bombay hospital, a pediatrician came and said, Swathi, I'm really distressed. My 8-year-old boy wants to know about whisper pads and I just don't know how to tell him. Should I tell him about menstruation, what I should do? So I said, get him to my clinic, let me talk to him and find out. So this boy, very cute boy, walks into my room. I said, hi, how are you? So he said, my father said you're going to tell me all about whisper pads. I said, of course I'm going to tell you. Come and sit down. I said, but tell me first, why do you want to know about whisper pads? He said, you know, because auntie, I see all those ads that whisper pehno aur kuch bhi karo, freedom. So I also want to wear whisper and I can be free. So I want to be a free guy. So then I told him, I said, you're a boy and you don't require this. And at that age, you know, they hate girls. So I said, girls are, you know, girls are not like you all. They require all this freedom. That's why they wear these whispers. Why you want to know? So he stood up and said, oh, this is a girly thing. I'm not interested. And he walked up. And then the father came and said, what did you tell him? What? I said, nothing. Your son just wanted to wear whisper pads. And when I told him it was girly, he left. So sometimes we overgive things. Like, you know, the joke. The father was asked by his son, Dad, from where did I come from? Then the dad had a 2-3 pegs of beer, read up all about the birds and bees and sat down and explained. And the son said, why are you telling me all this? I just wanted to know where I came from because my neighbor wrote in our form he came from Nagpur and I want to know where I came from. So sometimes when children ask questions, we unnecessarily give over information. Like I'll tell you about my younger son. When he was 12 years old, he came home and said, Mummy, I want to know all about homosexuality. My older son was sitting next to him. I told him he didn't like these discussions. He said, why are you asking Mama? So he said, Mr. Doctor, who else will I ask? So I asked a simple question. Why do you want to know? So he said, because there was discussion in the class. I said, okay, first you tell me all what you have learned, then I'll tell you more. He said everything which was needed about homosexuality without my opening my mouth. And after I said, I used to say, yes, this is right. And whatever was myth, I told him, no, this is wrong. So next day, this guy goes to class very proudly and says, you know, these 2-3 things you told were wrong. My mom is a doctor and she told me and he corrected their knowledge. I got phone calls from the various boys' parents. Dr. Bhave, can you please take a sexuality session for our children? And that was how my first sexuality session began with the peers of my 12-year-old son and their parents. So you have to just learn. And first of all, you have to be comfortable with your own sexuality. If you have come from a conservative family where you find it very difficult to talk about sex, that embarrassment shows on your face. And then the people who listen to you also are not comfortable. Our WHOP workshop, which I just discussed, you know what they first told us? They put these charts and they said, go and write down all the words for genitalia and sex which are put on bathroom graffitis and write them in various languages. And you know, it was so difficult, Jason. At the age of 55, I didn't know half the words which were there. And we not only were made to write it, we were made to read it. And we were made to read and explain what it means. My knowledge increased vastly in those 2 days. And I realized it is so much discomfort to talk about these issues. And then we realized that boys also, why do they write on the graffiti? Because they want to say this and they can't say it out, so they go and write it. So sexuality education is not everybody's cup of tea. You have to first understand, can I do it? You have to get trained for it. You have to be comfortable for it, and then you can do it.
Yeah, I know. I remember when we did our parents' education, PTA classes for teachers, said they cannot deal with these issues of bad touch and good touch.
Yeah.
So that's an issue. Now,
Yes.
another question by Geeta Patil is, how do you tackle sexual abuse in boys?
How do you tackle sexual abuse? See, just as we are talking of sexuality education, we talk of bad touch, good touch. Very often, boys are not considered to have sexual abuse. And you know, we freely allow our boys to go here and there. We take so much care of our girls. But there's a lot of sexual abuse in boys. And we have to tell them that age appropriate education, that nobody can touch this part. You cannot allow them to fondle your private part. You cannot fondle somebody else's private part. And I think if you do it with a very calm face, with pictures at the right time, I've done it to many adolescent boys. I've not had any problems so far.
Okay. Well, Deepa Jayananthan asked, how do you help teens handle failure?
How do you handle failure?
Boys handle failure.
Boys handle. See, the thing is, you know, right from childhood, we never say no to a child. And we always give everything what they want. So they don't get failure and don't get no for an answer. So what we teach is, don't say yes every time to a child. Suppose he wants an ice cream. Some days say no. Aaj time nahi hai. Today you have to first have your food. He has to learn to delay gratification. And that is the way they learn control. And you know this famous marshmallow experiment of Harvard, Stanford and Harvard, what this guy did was he took the children of all these professors and all, and they put marshmallows. These are sweet things we are using Christmas. And he put these marshmallows in front. It's called marshmallow experiment. And he said, those who eat them immediately will not get anything. Those who eat them after 10 minutes, 15 minutes, will get this. This is called delayed gratification. And then they found that those children who could not control ate them immediately versus those children who could delay their gratification. And they followed them over 20 years plus. And they found that those children who immediately ate the marshmallows were impulsive. They were more likely to have failed marriages. They were more likely not to sustain a career. They were more likely to have drug abuse. Whereas those children who could delay gratification had better marriages, better careers. So we have to learn to delay gratification and accept failures. And you know, you saw that movie, what was that, where I forgot the person who died. I'm now getting senile with my age. The person who queries suicide query, Sushant Singh. So that his movie which was there, he had that champagne bottle open. And he discussed that when you get into IIT, we'll open this bottle, we'll do this, we'll do that. There was never a discussion that if you don't get into IIT, what shall we do? And I always tell parents, have a fallback form. And whenever parents or children come to me for career counseling, I tell them, okay, you want to be a doctor, that's your first choice. What is your second or third choice? They said, no, but we want to become doctor. I said, no, I want your second or third choice. The reason being, I make those 2-3 options available and I tell them that exams are very dicey and it's a big competition. So even if you try your best, even if you're brilliant, it may happen that you may not get your admission to engineering, doctor, but you have to have a fallback plan. And you have to decide, if I don't get an engineer, doctor, IIT, will I go for architecture? Will I go for mass media? What will I go for? And then the children don't feel a failure. They just feel, okay, I didn't get into NEET, but I wanted to be an architect also. So I will go for architecture. So by not giving them any options, you corner them into one career, and then that sense of failure is immense. But if you give them 2-3 options, they feel okay, ये option था, लेकिन मेरे को दूसरा भी है, तीसरा भी है, and then they accept that second or third option very willingly. So every time we say, what will we do? Celebrate when you win. We also have to say, what will we do if you don't win? What will we do because you participated? You participated in Indian Idol, you didn't win. But let us celebrate that you participated in Indian Idol, and what shall we do? So celebration should happen regardless whether he wins or he does not win, because you are celebrating his participation. If you do that from the childhood, there is no question of rejection, failure. They take it in their stride. We as parents, we as society put so much emphasis on success, and we put so much worth of a child by his achievements. I had a woman who had come to me in Bombay hospital and said, ma'am, mere bachcho ko teach him motivation. I said, why? He's a very average child. And when I talk to all my friends, I feel very ashamed that, somebody's son has won tennis, somebody's son has come first, my son is nothing. So then I talked to her and I discussed with her and I said, how is your son liked in the society? He's very popular. How is he liked by the grandparents? Mom, he's one of man. He loves grandparents. And whenever he sees any old person, he'll catch his back. So I brought out what a wonderful son she has. What a wonderful human being she has. And she's not valuing it. She's not valuing his worth. And I told her that if I had an IIT son and he was arrogant, I would not feel proud about it. So I made her realize that having a well-behaved human being is something to be proud of. And I will tell you again about my younger son, because he had a lot of girlfriends, as I said, in the group. And his girlfriends' mothers used to say, Aditya, she will come for the party if you will escort her home, because we trust you completely. And I used to get a phone call and say, Dr. Bhave, can you please allow your son to drop my daughter, because he's such a gentleman and we really trust him. And I tell you, that was more pride from me than his coming in merit, than his getting USA admissions, that my son was considered a gentleman by the girls' daughters. But you know what was the problem? We had this thing, 11:30 party should stop and they should come by 12 o'clock home. We were staying in South Bombay, near Nariman Point. And by the time he dropped all these girls home, it would be 2 o'clock. And I would be worrying that my son is alone and he may be at danger. So what did I do? In his group, there was another boy who was staying close to my house. So I requested his mother, can Aditya and he, both of them, drop all the girls? So I'm not worried about my son being alone. So both of them came by 2 o'clock. After dropping all the girls, that boy slept overnight and next day that boy went home. So feel proud that your son or your daughter are well-behaved human beings. We should not go after achievements all the time. Success is very ephemeral. Finances, success comes and goes. What remains is your values, your personality, your relationships. And if you don't teach the children from that right from the beginning, they will never be happy individuals. Happiness is gratitude for people who have done something for you. Happiness is relationships. Happiness is enjoying what you do. Happiness is not comparing your graph with somebody. Never compare yourself with anybody. Each one has their own graph. Their personality, their limitations, their successes. It's like apple and orange. In my life, I never compared myself with anybody. That's why I never felt jealous of anybody. Because each one has some qualities which I don't have. I have some qualities which other people don't have. And if we teach our children, just compare your own graph. If you're better than what you were last month, last year, you're a better person. And over the last, now I'm 70 years old, and I read a book called Gail Sheehan, Pathways. And I read this when I was 30. And they said every 10 years of your life or decade, if you don't change, you are not a better person. You can't be at 30, 40, 50 the same. So if I'm at 60, the same rigid person, which I was at 30, I have not evolved. And over years, I have read personality books, I've done courses, I've done arts and science of relationship. And I'm certainly very different from what I was at 30, 40, 50. And at 70, I'm an evolved person. And they call that self-actualization, Maslow's theory. You have to come to a time now you say, achievements are enough. I have achieved. Now I have to give to society. I have to be satisfied with what I've got. And I must mentor. And I must feel happy to see the success of others. And feel the people who I have mentored come up. Then you are happy. If you want to continue even at 70, I want to be on the top. I want to compete. I want to be relevant. You'll never be happy. And that is what we start teaching children from when they're 10 years, 5 years, not when you're 70. I've got so many of my colleagues who are so depressed because they are not relevant, because they have retired, because they have nobody. I mean, that is not a state to be. 70 years should be the happiest time of your life. Before you are working for a living, now you are living for enjoyment, and you should just live. Any other question?
Okay. How do you counsel adults and boys with obesity?
How do I counsel adolescent boys?
Because it's about 10% of adults and boys with obesity will come back and sit.
Obesity, okay.
Obesity.
See,
They will
obesity.
they will not stand on the. They refuse to stand on the weighing machine again. They're so scared of standing on the weighing machine, and they don't. 10% of children will agree to all the exercise that you say that you advise. How do you manage that? Because institutional care is what is required for the morbid obesity.
I think obesity is a very, very complex disease, and those who have this obese tendency, it's a battle of the bulge. And those of you who have, like, I have been fighting with my obesity over years, and it's always like, you barely manage to remain the BMI of the overweight category. You can't go into the normal BMI when you have overweight, and then you have this. So I have tried to reduce weight. I've lost 10 kgs, I've regained 10 kgs because of all my health issues. But you have to be motivated. And what wrong thing we do is that somebody, when he becomes obese, has gained weight over 5-10 years. And we make a diet plan where he will lose weight in 6 months and 1 year, which is very unrealistic diet plan. So when I get my obese adolescents, I don't tell them you have to lose weight in 6 months. I tell them that you're going to lose weight over next 1 year plus. And it's going to be half to 1 kg per month. And if you do more than that, that's a bonus. But you don't have to lose 2 kilos, 3 kilos, 4 kilos a month. And if you do this sustained weight loss, that is half to 1 kilo a month over 2 years, majority of the obese children are able to maintain this weight loss. But when you do this drastic weight loss with this 1,000-calorie diet or with drugs and with unnatural over-exercise, a person who's got an obese tendency is going to rebound back. And it's going to be a sense of failure. So we have to give them a realistic plan. And first step is not to lose weight, but to maintain weight. That means suppose this boy is like 90 kg, I give him 6 months not to become 91 kg. That you maintain your weight for 6 months at 90 kg. So he at least knows, okay, I've controlled my diet, I've controlled my impulses, I'm not gaining weight. Then you start this gradual reduction. All my obese patients have a 2-year plan. I never give any weight reduction less than that, because it is not realistic,
Okay. Last question is, what is the difference between infatuation and love? Because, adults and boys say that we are mature enough to love. And you tell them that it's infatuation, love will require much more. What is love and infatuation? How do you explain to children?
See, normally what we tell them, that infatuation is something you can have for many people. You can get infatuated with one girl, fall out, infatuated with another girl, fall out. You can get infatuated with a hero, with a heroine, with a sports. Infatuation is just extreme liking for somebody. Whereas love is a much, much deeper feeling. And then we tell them that love means you can't live without her, or you can't live without that person, you miss that person and that person is not around. I have a lot of charts which I show them what is infatuation, what is love. And all of us know that this intense love, where you die for each other, comes only in the adolescent period. Romeo, Juliet, all these Sri Ranza, they all were 16, 17 when they killed each other or killed themselves. Can a 25-year-old man or a woman have that intense love where they commit suicide for each other? Very rare, because their frontal cortex kicks in, the executive center kicks in. And if one girl goes away, unless they are devdas and all that, they don't live their life over there. They rationalize and find another girl. But 16 to 17 is the time when it is all or none phenomena. And these boys, I give them a session. What is love? What do you like in this girl? She's very beautiful. That means it is skin deep. You just like her looks. Tomorrow, if she loses her looks, you'll stop loving her. Or he'll say, I like her because she's got a wonderful figure. So, okay, tomorrow she puts on weight, you'll stop loving her. So, you sort of analyze what he likes in this girl and make him realize what is important. I must tell you this story. You remember Amitabh Bachchan, how he propagated Dharmendra in Sholay picture, and he said all the bad points trying to make him like this. So my mom gave this counseling to my husband when he was 18 or 19 years old, when he said, I want to marry Swathi, and I was 16. So my mother sat and told him that you have seen how obese I am. She's got this obese tendency. So now she looks very thin, but she's going to be fat. She's got arthritis. I've got arthritis, which she's already got. She's going to get arthritis. And she's got very short temper, and she's going to fight with you. Remember that. So my husband said, okay, I know. I mean, even that you're fat, but you look nice. So if she looks fat and nice, I don't mind. Short temper, I'm a very calm person. I can deal with it. And arthritis, they're all treatment. So then she came and told my family, I've told him everything, what she's going to be. So now I'm very clear that he should not be disappointed later. So you do all these counselings about infatuation and love. And when I fell in love, I was 15 and a half and my husband was 18. And my son said that he was a cradle snatcher. And then my parents dealt with this. And I salute his parents and my parents, because this was way back in 1969. And they allowed us, of course, under close supervision, a courtship of 5 years. And they refused to get us engaged. They said that that time broken engagement was a big problem in society. They said, you become 21, let him become 23, and if you stick by each other, we'll get you engaged. So 5 years, we are not allowed an engagement. And only then we are allowed an engagement. So our parents manage our adolescent love beautifully. I'm supposed to write a book on this. Many people are telling me. So understanding what is infatuation, what is adolescent love, I think adolescents are quite smart enough to understand that. And in these sessions, we can make them understand. And very often they come to know what is infatuation, what is love, what is emotional manipulation, what are they really attracted about. Sometimes they want a beautiful girl because all boys are after her. And it's a trophy. And it's not love. They are very happy that girl is my girlfriend. They feel nothing about the girl actually. But she's a trophy to be carried. Or they feel this girl is so worshipping me. I'm a sports star. This girl is worshipping me. So it satisfies the ego. She's worshipping me. So we have to make them understand about what is relationship, what is true love, what is real facts. How do you assess that she really loves you or you really love her? I think, Jason, we can do it. It's not that difficult.
Yes, it's the trust.
Yeah.
Love is trust. You know
Yes.
that person. You care for that person, and you're not bothered when that person talks to another person. If a lady, if you're in love, the person you love talks to somebody else, you shouldn't get upset because you know that she trusts you.
Exactly.
But trust is so much important in love.
I think even in marriage, Jason, that is important. How many wives like the husbands talking to some other beautiful women?
So that's most important. So when you get jealous, so you get angry with the person who talks to you, a person you like, that's not love.
Very important point.
It's very difficult. Anyway,
I also teach the girls and boys that if your boy or girl is forcing you into a premarital relationship, which you do not want, and if that person says that if you love me, you'll sleep with me, you have to negotiate and say, if you love me and respect me, you will not sleep with me because I don't want it. So that is also negotiation and trust, that you accept the other person.
Fantastic. I think Swathi has answered a lot of questions about boys and their relationships. If there's any more questions, please be free to ask because she's willing to spend some more time. I've finished what I have to say, and I hope you're all happy with what Swathi has delivered. I'm unhappy that MKC is not here because you have given a lot more insight into this topic, but I'm sure if there's more topics, I think more issues that you want to discuss, Swathi is willing to answer.
Yeah, if you want to put in the chat box, I'll see the...
Asha says, he's got many girlfriends even now. and he's got his mustache all blacked up and looks so young even now. Where's that guy? He's not visible. Anyway,
he's still in that international forum.
Yeah, okay. Any more questions, please? Otherwise, we'll ask Deepa and Ranjit and all or Sibi to take over. Thank you so much, Swathi.
Thank you, Jason sir and Swathi ma'am. It was an excellent session. Don't know, actually, I regretted telling you 40 minutes. I should not have told you that. Really enjoyed, learned a lot.
Thank you so much. It was enjoyed.
And Jason sir for chairing the session out of blue. He just came in and helped us. Thank you, sir. And,
Jason on the spot can do anything.
Yeah, we know that. Now, Shweta, you can take over.
Okay, ma'am. What an evening and what a presentation. Thank you, Swathi ma'am, for enlightening us so much. And thank you, Jason sir, for stepping in so gracefully for this evening. Now, to wind up this evening, let me invite Dr. C.B. Kurian, the vibrant secretary of IAP Trivandrum, to deliver the vote of thanks.
Thank you, Rita. On behalf of IAP Trivandrum, I would like to thank the AACCI chapter Kerala for giving us an opportunity to host this session. And I'm really excited and very much thankful to Swathi Madam for that excellent and wonderful talk, because till this time we have been hearing a lot of academic sessions throughout, and a session totally different from all that, and which is very much required in these days, because as you have already told, a lot of crimes and sexuality questions rising up among the adolescents. These topic advance a real great importance in today's lives. And I'm very much I'm adding from my own side that you had really talked very well about the masturbation in adolescence. Actually, in today's world, as you see in India, there is a lot of communal things, and people are getting more and more religious in these scientific days. As man's scientific nature increases, people are getting more religious. I'm not going into the political aspects of that. And regarding in Christianity, I'm basically a Christian, and in our Bible it's written that if you think about a girl in a sexual way, it's a sin. So in our churches and in our Sunday school, we have actually taught that masturbation is a sin. Even though masturbation is a sin, everybody masturbates. And the problem is that when they go to the church, they start feeling guilty. And this guilt keeps rotating in the minds of the youths. I still know many people who still thinks that masturbation is a sin, and they advise the children also, even till this day. So you have actually thrown a very good light. I think that this talk should be thrown around to all the people around the world, and to all the pediatricians, and to all the religious fanatics. And thank you so much, ma'am, and thank you once again. I just can't stop praising you enough.
Dr. Sibi, I think Dr. Sangeeta Yadav wants to say something.
Yeah, madam, please.
Thank you very much. Thank you, Dr. Bhave. I just wanted to add a small comment that Dr. Bhave and Dr. MKC Nair have created a national park of adolescent pediatricians across the country. And they have been our leaders, and they have actually taught us a lot with their experiences. And really hats off to them and salam to them. Thank you very much.
Sangeeta, you are part of my journey, and you're equally an adolescent expert. All my activities have been with you since 2000. So you're equal part of my journey.
I've been learning from them ever since 2000, when we all got together to take this whole mission forward. And in 2002, Dr. Bhave did the international conference. And that's how this whole national park has been created. That's what I wanted to add.
Thank you.
Thank you,
Sangeeta Madam. On behalf of IAP Trivandrum, I would like to thank Dr. MKC Nair, sir, for his inputs, and Dr. Jason sir for taking over the chairperson and making the session more lively by more questions, which most of the things which I also wanted to ask.
Jason was bombarding with me questions before I finished the answer. He had a second question ready. But Jason and I go a long way back, and he's a wonderful friend and an excellent adolescent expert and a developmental expert.
Yes. And thank you, Dr. Vijay Kumar, our state president, Dr. Jody Sebastian, our state secretary.
So I once again thank IAP Kerala, IAP AACCI and Trivandrum.
And our AACCI Kerala, Kerala chairperson, Dr. Shishibu, and Secretary Dr. Deepa Janardhan, who was the brain behind this session, who had organized everything, and Dr. Ranjit, the past chairperson of AACCI Trivandrum and the EB member of this AACCI in the South Zone. And also my dear Asha Bengappa madam, who made the session lively in the chat sessions, and also the seniors like Parvati madam and Sankita madam. So once again, on behalf of IAP Trivandrum and on behalf of my president, Dr. Rukmini madam, I extend my sincere thanks to AACCI chapter and IAP Kerala for giving us an opportunity. Now over to Dr. Deepa.
Thank you all. Thank you, everyone. Anything, Ranjit sir, you want to have any comments?
No, it was an excellent session as advice. I had a fortune of attending madam's class at Dy Patil hospital before the pre-COVID 3 years back. So we had so many experiences from there, and we had a fun moment and with the AACCI members there. So I still have the fond memories 3 years back.
Ranjit, you are a very good student. No? You did very well.
Okay, thank you very much. And we had so many movies today. Madam had mentioned so many movies, so I want to see that.
Yeah.
Parvati ma'am, any comments, ma'am? Ma'am, you're muted, ma'am. Parvati ma'am, you're muted.
Excellent talk, and as usual, madam. And we didn't know that time has gone. It is already 9:37. Madam.
Thank you, ma'am. Thank you, Madam Parvati, for being there. Thank you.
It was always a pleasure listening to you.
Thank you.
And
when you are appreciated by senior people like you, it's very gratifying.
okay. Good evening to all.
Yeah.
Good night.
So all good things must end. We'll meet again.
We'll meet again.
So you have your South Zone in Cochin. Let's hope you all can come.
Yes,
okay.
Looking forward for your workshop there on anger management.
Yeah, we'll do that.